Intramuscular or IM injections in birds are given into the pectoral muscles. The pectoral muscle mass consists of superficial and deep pectoral muscles with a prominent fascial plane in between. The pectoral muscles are the only site recommended for IM injections in birds. With the bird properly restrained and exposing the ventral breast region, wipe the plumage away from the featherless tract along the ventral midline with isopropyl alcohol. Avoid any pre-existing visible muscle bruising or other lesions. Select a small, short, 25 to 30 gauge needle. Insert the needle at an acute angle measuring less than 30 degrees into the superficial pectoral muscle. Intramuscular injections are typically administered in the middle third of the pectoral muscle mass and lateral to the keel that protrudes on the midline. Avoid the cranial portion of the pectorals because the neurovascular bundle feeds into this region from below. Caudally, the underlying sternal bone thins and portions are only fibrous connective tissue with the liver lying deep to it. Do not insert the needle too deeply as it is possible to hit the sternal plate of bone. If you feel the bone, back off to place the medication into the muscle mass. In rare instances, medication may also be deposited in the fascial plane. Aspirate back on the syringe as you would in any species, then administer the medication.